So good afternoon. I'm Phyllis Quinlan, and I am a board member of the Share the Caregiving organization. I met Sheila several years ago through a mutual friend, and we were introduced because Sheila had this wonderful not-for-profit organization, and I happen to be a nurse. I've been a nurse for 40 years. There was just a compelling message that came across with Sheila and what the mission and the vision of this organization is about. And it hit me because being a nurse, I realized that family caregivers don't have the support that they need, and patients often really truly want to stay in the community but cannot because there's just not enough support for that patient, but more importantly for their family caregiver in order to make that a reality. So many patients are going into assisted living or long-term care facilities at a much earlier age. Reluctantly, they're going there, and of course they're getting excellent care in those facilities, but it's nothing like being at home. The Share the Care organization is a not-for-profit organization designed to support family caregivers and the patients staying in the community. They have a better quality of life. The whole action-oriented program really addresses body, mind, and spirit. I just see it as being so person-centered and so supportive of family caregivers that I was compelled to start to get involved with Sheila until she finally gave me this gracious invitation to be a board member of the organization. But from the perspective of a nurse, and I have held many positions in nursing, educator, clinician, administrative, and now I am an internal coach. From the perspective of a nurse, this is invaluable. There is a disconnect between what our patients need and what our organizations currently are offering our patients and their families to really prepare patients and families for a supportive, safe discharge. We give them a lot of material that many of them are overwhelmed to even read. We all know the issues of health literacy. We all know the issues of diversity. We all know the issues of people with English as a second language. But when you really put the patients and the family caregivers, friends and colleagues, support groups, church groups, volunteers around them, and they feel the support and the love that comes from that community, then they are empowered to be able to stay safely at home. And when things get a little dicey, and there's questions and people might have an exacerbation of some part of their chronic illness, well, then the support group supports the family caregiver as they have to reach out to healthcare practitioners and get the information need or follow the protocols that are set in place, or put a phone call into the visiting nurse association that is, perhaps working with that family. But there isn't that jump to, oh my God, call 911. And that is so important. The last place these patients want to be, and the last place the families want their patients to be, and their family member to be, is back in the hospital. And this supports that. Now we know on the opposite end that we have a mandate, and a very important mandate, to reduce the amount of avoidable readmissions as possible. There are two main reasons why people go back to the hospital in an avoidable manner. One is they don't understand their discharge instructions enough. Two, and that is, along with that, of course, is their medications. And secondly is caregiver being overwhelmed. And that out of the last resort and sometimes a sense of panic and a need for a respite, a family caregiver might call 911 out of a sense of urgency, and the patient is then readmitted. This program, this evidence-supported program, reduces the risk of that second cause of avoidable readmissions. It supports the patient and, more importantly, the family caregiver in being able to think their way through situations as opposed to feel their way through them in panic. This is groundbreaking, absolutely groundbreaking. And as I get more and more involved with Share the Care, more and more applications of the program start to pop up. We were speaking today with some academic representatives from a local college in Connecticut. And as we were talking, it all became very clear that the program may teach and does a wonderful job in teaching protocols for how to develop care circles around patients and care families. But what about introducing this into nursing programs, social work programs, schools of medicine programs, or other professional caregiving programs early to start to anchor the notion of empathy and compassion, to start to anchor the notion of what family caregivers really need and how people really feel and understand and communicate, so that by the time they're actively practicing at a third or fourth year level, or maybe graduating and going to a first job or an intern or residency program, this is already part of their foundation. The applications of this program I think we're just scratching the surface of it, quite honestly. I think that it has a fundamental mission and vision, which it is doing, not just in the United States, but around the world. But I think there are going to be ripple effects that are going to be felt throughout healthcare tremendously. And I just encourage everyone to buy their copy of the book and reach out to Sheila and see how Sheila and Share the Care can really bring your organization to the next level, so that you are really doing what the Joint Commission needs us to do for continuity of care with family discharging, and what we really need to do ethically, morally, and clinically for our patients, so that they have the best shot at having a full life, a life that, you know, addresses body, mind, and spirit, but not just for the patient, but for the caregiver. And we owe it to them as part of a wellness program and healthcare practitioners to give them the best opportunity at achieving that goal.